and I'm honored to introduce you to Sharon Dornberg-Lee, Clinical Director of Community Services at CJE SeniorLife in Chicago, who developed an interest in meeting the needs of solo agers after providing psychotherapy services to many solo agers over the years. Sharon is a frequent presenter for community and professional audiences on the topic of solo aging. This is her return trip to Derote, and she's developed a support group at CJE for those who are aging alone, which is one of the first of its kind. So we're honored to welcome Sharon back to Derote, and we thank you all for being with us.
Hi, everybody. Thank you so much for inviting me back, and I'm especially honored to be here with you on Savvy Day, and also to talk about a topic that I feel very passionately about. So a little bit more about me in a moment, but first I wanted to tell you just a little bit about my organization, CJE SeniorLife. We were founded in 1972 as the Council for Jewish Elderly, and our mission is to enhance the quality of life and facilitate the independence of older adults. We provide a really broad continuum of community-based services. We have affordable housing and assisted living options. And our community services, which is the part of the organization that I work in, includes everything from mental health care and care management to adult day services. We have a robust set of cognitive wellness services, caregiver support, benefits and legal services. We have meals and transportation, and then lifelong learning and enrichment programs. And every year, our programs reach about 20,000 older adults and their family members. As Claire mentioned, I am the Clinical Director of Community Services, and I've been at CJE now, even though I can never believe it when I say it, for almost 3 decades. And I oversee clinical intake and counseling services and provide clinical leadership training and consultation for all of our community services programs. But the other hat that I wear is I work closely on advocacy and policy initiatives related to aging for CJE, which is what we're here to talk about today. So this is our agenda. Why is solo aging even a policy issue? What policies can help to foster positive solo aging, both at the very specific level for those who are aging alone, but also what effective aging policies support solo aging. And then, perhaps most importantly, what can we all do to move those and other policy ideas forward? So first of all, and feel free to interrupt me, Derote moderators, if there's a question that I should get to sooner rather than later. Otherwise, I'll make sure we have time for questions and discussion at the end. But first of all, why is solo aging even a public policy issue? Sometimes if you are the individual who is a solo ager, it may seem like just an individual level concern. But it's really important to realize that this is a societal issue and that there are many systemic factors that are really behind the fact that there is a growing number of solo agers. Things like our global economy and the fact that people move around more for work and have less, community ties to their extended family is one of the factors that's increasing the number of solo agers. People have smaller families to begin with. People are living longer, as we all know. People have, sort of another way of saying it is reduced kinship ties. People may be less connected to faith-based communities or other community organizations and institutions. And we just have changing social mores about what our obligations are to our extended family that's changed from a generation or two ago. So kind of all of these cultural and fiscal and economic trends and demographic shifts are all contributing to the growing number of people who are aging alone, and therefore it very much belongs in the policy domain. How can we as a society respond to the needs to a growing number of solo agers? So changing public policies aren't going to change those trends that I just mentioned, but what public policies can do is they can try to promote a broader shared responsibility for the solo agers in our communities. We can identify what are some of the gaps that exist for solo agers in terms of services and supports, and how can we develop policies and programs to fill those gaps. And then finally, good public policy around solo aging can serve to increase awareness about this growing and underserved population of solo agers. So those are kind of three broad ways in which public policy can be brought to bear in a positive way to help the concerns of solo agers. So what are some of the things that I would recommend or that I've heard other people recommend that might be useful? One of the ideas that one of my mentors had that I think is just such a great idea is under the Older Americans Act, the federal act that funds many of our aging services across the United States. Caregivers, family caregivers, are a priority population, and therefore they get funding for caregiver respite services, caregiver support services, information resources for family caregivers because they're identified under that act as a priority population. Well, why can't solo agers similarly be identified as a priority population under the Older Americans Act? That would bring additional resources and disseminate successful models across the country. So that's, I think, a wonderful suggestion. As far as I know, there's no movement in that direction or any pending legislation or anything like that. But I think that's a wonderful idea of a positive policy recommendation. In many states, including my state, Illinois, there are now multi-sector plans on aging. In Illinois, I was really honored to be appointed to the governor's community task force to develop that multi-sector plan as part of the advisory committee. And so I learned a lot about the process of kind of, how to develop effective policies that are going to work for older adults at the state level. And so we've now just developed in Illinois a 10-year plan. I kept being the voice for saying, don't forget solo aging. And as part of that process, not that much made it into the final plan about explicitly talking about the needs of solo agers. But I think a lot of our proposed initiatives will address the needs. But now I'm on one of the implementation committees where I can continue to be that vocal presence in talking about the importance of solo aging and how the needs of solo agers are going to be addressed and highlighted in the implementation of that 10-year plan. So if your state doesn't yet have a multi-sector plan on aging, try looking that up. And the idea is that we need a plan on aging at the state level, working in partnership with nonprofit community and other partners to address the needs of older adults, not just through a narrow department on aging, which we have too, but across all government services, whether it's, the Department of Motor Vehicles and the services they provide through the Department of Human Services and public benefits like Medicaid and SNAP, to give just a couple examples of state agencies, but it's a broad array of housing, you name it, any state agency is part of this multi-sector plan. And there's really a focus on equity, and we can also think of solo aging as an equity issue. So I encourage you to look into that in your state or reach out and ask me more about our plan in Illinois. I also think that we need to look at what are some ways to have national models disseminated. Local models disseminated at the national level. And that's where policy can play an important role too. So certainly DeRote's model for Aging Alone Together is one great example of a successful model, and it's a national model. But how can we replicate that through many other organizations and programs across the country? And how can we then find funding for that model, make sure the word is out, look for ways to establish the evidence base for the effectiveness of the model? Those are all roles for public policy, is find a program that's working really well and then use a policy to create seed money to disseminate that information and help other organizations implement it at the local level as well. The village model also comes to mind as another successful local model that we can help through policy, through funding, to disseminate nationally. So the village model is not explicitly for solo agers, but it serves many, many solo agers. It is a membership association. People pay a membership fee, and it's usually a modest fee. And the organization is developed and run by older adults in local communities. People just live in their own homes. It's not a residential setting. So it's more of a construct, the idea of a village, where there's an organization that either provides linkages to social and educational activities, as well as concrete services like home care, transportation, information and referral. And there are about 250 of these villages now across the country, and another 100 that are coming on board. I put the link to that national network. What if we had a solo aging component to all of those villages? Or what if we created something brand new that was the solo aging national model to provide that kind of a grassroots, locally implemented by and for solo agers movement, where we can provide the missing gaps and services that would be beneficial to solo agers. Also, things like Savvy Day, the Solo Aging Visibility Day that we're celebrating today, is a wonderful model that public policy could play a role in disseminating nationally. So it's not just one organization trying to get the word out and then hoping others will pick it up, but how can we provide some government funding? How can we provide the government, ability to share information broadly through groups like SAMHSA, for example, or through the Administration on Aging? How can we get the word out about these successful models that are doing so much good work? One of the things, and this is just one example that comes up all the time with people who are solo agers, is they don't have somebody to serve as power of attorney, or they don't have somebody to provide the kind of care management function that professionals can provide, but that can be really expensive, and that a lot of people don't have access to because it's cost prohibitive. And yet we know these things can really help people be, continue to live in the community for many more years and hopefully avoid things like nursing home altogether at the last part of their lives. So one of the policy ideas is, why not publicly fund some of these services, like private care managers who can serve as a power of attorney, or give some money to people who are already serving in these roles, like some CPAs and financial advisors or attorneys are willing to be a professional fiduciary. What if that was a publicly funded service, but only for those who didn't have the financial resources and didn't have anybody to name in their family as a power of attorney? There are also some banks that will serve as an executor when somebody dies, but you have to have a pretty large nest egg for banks to want to serve in that role. What if that was a publicly funded role instead, that we could appoint somebody as an executor who would approach the task in the same way a family member might? So there are some of these things out there that are already publicly funded, some care managers through our state Medicaid waiver programs, but they tend to provide very little in the way of care management. Most will not serve as a private fiduciary or POA. So how can we expand those roles and the public funding of those roles to provide a more robust level of service and to meet those gaps that often solo agers are experiencing? Another really important role for public policy has to do with housing options for all people as they age, but especially for solo agers who often have particular needs and interests in terms of housing options when they get older and find that not a lot is out there to meet their needs. So I wanted to mention just a couple of innovative older adult housing models. Again, I don't think any of these are explicitly for solo agers, but they meet the needs of solo agers really well. And we can use public policy to better fund these opportunities, to create seed money, to create new innovative housing models, so that there are more than just a few of these. So I wanted to just talk briefly about a few of them that are out there. The first is the naturally occurring retirement community, or NORC. And so the idea of a NORC is that some buildings just have a large population of older adults that are aging in place, which we all hope to do. to the point where they just naturally become a majority of older adults. For example, there's a building in Chicago called the Edgewater Beach Apartments. My friend Angela lives there. She's an older adult in her 80s. And that would definitely be a naturally occurring retirement community. There's a lot of older adults living there. And so a NORC would be like, let's identify that building as such, and then bring in services that can be publicly funded, whether they're social and recreational activities or whether they're social services or a combination of the two. I think most of the models that have existed are more social and recreational, but it would be even more effective if you could bring some needed services right on site in those buildings. And then it could be staffed by a community nonprofit, but government funding would be needed to help create the revenue base to have that be an ongoing program. So NORCs, can we identify more of them? Can we make them more robust? And can we make sure that they're meeting the needs of older adults? So it's not really a housing model per se, in that it's just using existing housing where a lot of seniors happen to live. Co-housing is another option where it's not just for older adults, but it's an intentional community where people have their own house or apartment, but there are shared common spaces that all of the residents use together. So people might make dinner together and eat dinner together every night. They may have, a clubhouse or something where they can have other social activities, and they live together as a community where they would have regular meetings and make decisions collectively. There are only 19 of these in the United States. In Illinois, we have one in the nearby suburb of Oak Park called Oak Park Commons. I gave you a couple links, but I've had clients ask me all the time, I've heard of co-housing. Something like that would be perfect for me as a solo ager because there would be sort of a built-in community and supports. And also people like the idea of multi-generational living. But then there are so few, especially in big urban areas. I know that there are more like out Southwest and New Mexico and California. I think there are more of these. Most of the 19 are probably in those locations. But what can we do as a society to further this model and to use innovative government programming to seed money to create more of these and to share the expertise nationally to disseminate the models that are working well? The final one I wanted to mention today is something called CCRCs without walls. And this was new to me. CCRCs are continuing care retirement communities. And the idea, you may be familiar with this, you buy into a community. You might start out in independent living. If you eventually need more care, I have to sneeze.
Bless you.
Thank you, preemptive. If you eventually need more care, then you can buy or move into assisted living. And then finally, if you should ever need nursing home care, it's all on one campus. So that's a CCRC. This idea takes that a step further and is called the CCRC without walls. There are 29 of these across the country. I'm not familiar with them. I don't think there are any in the Chicago area. But the idea here is you continue to live in your own home. But if you need help, then through joining up with this CCRC without walls in advance, they'll send the help to you. This is a fee-for-service model. Home care aides would help provide, assistance with things like meal preparation or bathing or what have you. But then at some point, if you're like, I really can't or don't, feel safe living at home anymore, then you would go to this larger CCRC campus community with different levels of care. So this would probably always be a private pay model. But again, I think that government can play a role in disseminating these models. I never even heard of them. I've been in this field for 30 years. So government can play a role in letting all of us know about the innovative models so we can form, opportunities in our own communities to build on these. What else in terms of policy recommendations? I'm going through a lot here. I'm giving you kind of the laundry list of things that I think might be helpful with respect to solo aging. This list of bullet points here are all things that solo agers identify as needs for them, where they have special concerns and unique concerns as people who are aging alone. Who's going to provide care for me if I need care? How am I going to get somewhere? We can't just assume that when you go in for a procedure, there's somebody to drive you home. And yet doctors' offices assume that all the time. Who's going to pick you up? You may not have anybody. What's the transportation option? Who's going to advocate for you? What kind of benefits assistance you might need? Who's going to serve as your POA? Tech help. So many people who are aging alone need more tech help than they can get with their computers, their phones, their smart TVs. Opportunities for social connection are important for all of us, but especially important for people who are aging alone. The housing options that we just talked about that are going to meet your needs as somebody who doesn't have family involved or not nearby. Medical care, care management, we talked about this. Pet care is huge for people who are aging alone or living alone. If you need to go into the hospital, who's going to take care of your pets, especially if that happens unexpectedly? And then financial planning is a big one that we touched on. And then finally, and very important, not the least of which at all, is emotional support. What are the ways to get emotional support? So my idea is we really need specific resource lists. A lot of these resources do exist, but there's no even local directory of them, let alone a national directory of who can provide all of these things and at different price points for people who can afford to have a pet sitter, for people who have no resources for that at all. We need a directory that's kept up to date, that's easy to access, where it's all in one place. You don't have to go around to 20 different organizations, government agencies trying to figure out how do I age as a solo ager. It shouldn't be that complicated when some places there are just gaps in services, but so often people just don't know how to find them and connect with them, and they're not in one place. So at the state or local level, if we had websites that said, are you, and they could be supported by government and not, therefore would need government funding. That's the policy piece, is to have legislation to say, we're going to create this website and it's going to be for solo agers. Are you aging alone? Here, everything on this list is a tab on that website of where you can find all the resources you need and learn more about what you need to be planning for in advance of those needs. And again, I think it's so important that this be directed specifically for solo agers. So often, if you are a solo ager, you know the things that are out there make a lot of assumptions that don't fit for you, that don't make sense for you because you don't have family support. So we can't assume that there's somebody who can take care of you over the weekend if you are coming out of the hospital and need somebody to go pick up your prescriptions and go to the store. And often people are discharged from the hospital with no regard for the fact that you may not have anybody to do that. You may end up right back in the hospital because there was nobody to go pick up your prescription. We see that all the time when families either live far away or the person is aging alone. And so all of these resources need to help you put together a plan as somebody who doesn't have family nearby who can step in and not make assumptions about the fact that there's family available to help with these things. The other thing I want to say about public policy, those are some ideas that are more specific to solo aging, but also good aging policy is good solo aging policy. So the services that we already have that are for all older adults need to be robustly funded, and funding cuts that are happening right now need to be reversed because those benefits and services support all older adults, whether you're a solo ager or not. So we absolutely need to continue to advocate for additional funding for the Older Americans Act. The Older Americans Act provides funding for things like home delivered meals or congregate meal site, transportation, some care coordination, homemaker services, senior centers, those healthy health promotion, disease prevention programs, take charge of your health balance programs, those kinds of things, diabetes management programs, and then elder abuse prevention. All of those services that we all rely on are funded through the Older Americans Act in whole or in part. And it's also, though, only a $3 billion a year program, and Medicaid and SNAP are $1 trillion a year programs. So the Older Americans Act can be overlooked in these funding fights that we're having right now. And as older adults, we all need to make sure that the Older Americans Act is not overlooked. There was a leaked budget early on in the beginning of 2025, about a year ago, that had very steep cuts to the Older Americans Act. And we really came together as an aging community across the country and completely fought against those cuts, and they never happened. We got flat funding. So flat funding is like a cut with inflation and with a growing number of older adults, but we were still very happy to have that flat funding rather than huge cuts in existing dollars in 2025. And that happened by policy advocates. In our communities in Illinois, we had 28 events, I think, in one day across the state of Illinois. And those were organized by our area agency on aging. And so the AAAs, the area agency on agings, can themselves be very active, but we also need all of you to be active as constituents and members of your communities to say, hey, we need Older Americans Act robust funding. The other thing that was going to happen last year was they dissolved the agency that was overseeing all of the Older Americans Act funding, and they were going to kind of disperse those programs to the four winds to various different federal agencies. And so we were able to effectively advocate for them to at least remain together in a new agency that was created, the Administration for Children, Families, and Communities. So while not ideal, we were really pleased that at least all those programs are staying together now rather than being dispersed, which is a benefit to all of us. Some other things were just, we need continued robust funding that really serve us well. And I could name a million other things, but these are some of the things that came to mind. Is the Senior Health Insurance Program that provides free help with Medicare and insurance is a really important program that we need continued robust funding for. It's under threat. Another thing that came to mind, I think, is that anybody is vulnerable to a scam, and it's a billion, so many billions of dollars are scammed away from older adults every year. But in some ways, solo agers, I think, can be even more vulnerable if they don't have family involved, kind of looking over their accounts or what have you. So I think solo agers can be even more vulnerable to scams. And one of the things that would really help from a policy perspective is that right now bankers are not mandated reporters of suspected elder financial abuse. And the banking industry has long pushed back against that. And there's always legislation to try to change that. As I'm saying this, I think that this is true in most states. I'm most knowledgeable about Illinois. In Illinois, there's also another bill right now that is to try to make banks put a hold on any delay on any transactions that seem suspicious so that they can check it out and make sure that this is not financial exploitation. So it slows the process down. If somebody's about to give, their life savings, $30,000, whatever it may be, to a scammer, the bank would automatically have to put a freeze on that because it's a large amount and there's suspicion. So there are lots of ways in which we can do more to protect older adults from financial scams that are really important from a policy perspective. Medicaid waiver programs provide most of the funding for in-home care for lower income individuals in our states. And so we really need continued robust funding for these Medicaid waiver programs that support in-home and community-based services, as well as something in Illinois, we call it supportive living, but I think there are different names for housing across the country that is similar to assisted living, but as Medicaid funding. In some states, Medicaid funded rather. In some states, these are more of a group home setting. In some cases, it's more like an apartment building where it's very similar to assisted living, but funded by Medicaid. And the idea with all of these Medicaid waiver programs is it costs a lot less for people to live outside of a nursing home. So the federal government provides a waiver of what would normally be funded by Medicaid, which is nursing home care, and to use Medicaid dollars instead for less expensive and also much more desirable programs that help people age in place in their communities, mostly through home care. So that's why it's a Medicaid waiver, because normally these Medicaid dollars would be directed toward nursing homes. But what we're really worried about is, as there are HR 1 going to be many Medicaid cuts in mandatory spending, things like nursing homes, and medical bills for people on Medicaid. They're going to be steep cuts. And as those cuts continue to roll out, these optional Medicaid waiver programs might be a place that states start to look as a place where maybe we can cut over here because we know we're losing money over there. So we all need to advocate for continued robust funding for Medicaid waiver programs. In Illinois, it's called the Community Care Program. In your state, it's probably called something else. But we really need continued funding for those vital programs that help so many lower income people age in place at home. We need adequate Medicare reimbursement rates for things like psychotherapy, which my organization provides, but also for medical care. And then we need just continued funding for Medicaid, energy assistance, SNAP. All of these government-funded entitlement programs are really vital for any individual who is aging alone or anybody who's aging in general. These are important programs that support all of us as we age. I'm going to skip this slide. This goes into more details about different types of Medicaid waivers that you can read on your own if you so choose. But I think I mostly covered this on the previous slide. So what can we all do to try to advocate for policy ideas like these, or for continued funding for the services and programs we already have? And this is where all of you come in and where all of us come in, that we all need to be vocal advocates. So this isn't somebody else's job to advocate. And like, oh, I hope AARP is advocating for these things. Well, they are advocating for some of them. But what makes a large organization like AARP effective is its huge membership that they can mobilize to then reach out directly to their legislators. So AARP is one example, but there are many other organizations that you can sign up for their advocacy alerts, and then you're in the know, and you can then reach out to your elected officials at both, I should say, the local level too, but especially at the state and federal level, to be reaching out to your legislators to say, hey, this program is important to me. And you can call them, you can leave a message about a particular piece of legislation, or you can just say, I want to talk to the senator's person who deals with issues concerning aging services, and then say, you know what, I'm aging alone, and these are some ideas I have. Would the senator, would my congressman, would my state rep want to support some legislation around some of this, right? Anybody can take that action. And you're also identifying yourself as a solo ager and making them more aware of this growing population. When you do reach out, whether it's regarding an advocacy alert or whether you just decide to call them up and make an appointment to meet with them at the legislative office, be sure to share your own stories. People are moved by stories. So if we say, oh, there are this many million people who are aging alone, that's important. But what's even more important is for you to say, I got out of the hospital and I had nobody to help me with what I needed to make that transition. The home health nurse didn't come. She couldn't run errands for me. There was nobody to do it. I ended up back in the hospital. You know, these are the kinds of really personal stories that move people to sponsor legislation and to support funding for existing programs. If your local organizations are having a rally or an event or a press conference and they're inviting members of the community to participate, please show up. We need everybody's voices to be effective in this way. And I put just a list of websites here of organizations that I think are doing great work in this arena. And please, you probably have others that you can share and suggest. I put AARP, Justice and Aging, US Aging, and ASA Aging. They all have advocacy programs. And then at the local level, find out who your area agency on aging is and see if they have an advocacy page on their website, and you can sign up for alerts about pending legislation and other initiatives. I also just put some other ways to stay kind of informed about policy with respect to aging and solo aging. I put a couple of podcasts here. Navigating Solo has a podcast. John Hartford Foundation has a podcast about, it's called Real Life with the Older Americans Act. Hartford also has an advocacy. I'm trying to remember myself what this resource is. Oh, for age-friendly communities. So this is an advocacy page specifically around age-friendly communities. And then I put a couple of great resources, I think, just to stay informed about what's happening in the news, in the health news and the aging news, KFF Health News and Navigating Solo's website. And that's it. I am not going to go through all these slides about CJE because we are a Chicago metropolitan-based area, and I realize most of you are probably not from the Chicago area, but I just included these slides, which you'll get in a PDF after the training if you want to know about CJE or understand more about our programs. I think what I'm going to do, I know that the very last slide right here has a QR code with the evaluation for today's program, but so that I can better see all of you. For now, I'm going to stop sharing, and then I will put back up on the screen before we end today that QR code so you can do the evaluation if that's okay.
That sounds terrific.
So that was a lot to listen to. Thank you for listening to all of that. Thank you all for being here. What questions or comments do you have, or what didn't I talk about?
So first, thank you for this informative, thoughtful, chock full of information